Hello everybody and welcome to my channel. This is Dr. Mridula V. Amarnathya. So today I thought I'll discuss with you a topic which most of us might always take it for granted. That is the umbilical cord care. Okay, so newborns, we know that every little structure in them is extremely delicate. And we need to take that extra care to make sure that they don't get infected, they don't fall sick. Because they fall sick, yes, it takes time for them to actually recover from it. So one such thing is the umbilical cord. Most of parents, we might be, quite tempted to, remove it or wonder when that stump would just fall off and start meddling with it. But let me tell you, there are some things that we clearly need to follow and make sure that the umbilical cord is safe. Okay, so stay tuned. So what exactly is this umbilical cord? The umbilical cord is a tube-like structure that carries food and oxygen from the mother to the baby while pregnant, and it also carries all the waste products away from the baby so the mother can get rid of them. So after you give birth, the doctor generally clamps and cuts the cord. And the cord has no nerves, so neither you nor the baby will have any pain sensation. So usually they leave a small stump on the child's belly. Now this could be anywhere between ½ inch to 1 inch long. At first, probably as soon as the baby is born, the stump might look a little shiny and yellow. But eventually it starts drying out and it becomes brown or grayish or sometimes even purplish or bluish in color. And over a period of time, it turns into blackish color and then slowly starts falling off. So usually the umbilical cord takes, the stump for it to fall usually takes around 10 to 14 days. But for some kids, it can take as long as even 21 days. So we need to wait patiently and do not try and meddle with it and forcefully try and remove the stump. So next, I'm going to share with you some simple tips, around 4 to 5 tips, which you must keep in your mind while taking care of the baby's umbilical cord stump. The first one is be gentle. That's like the underlining point. Be gentle, keep your hands off it and do not ever try to pull on it. Okay? The second one is make sure you keep the cord always clean and dry. I repeat, make sure it is always clean and dry. Probably you could skip the tub and sink bath and give your baby a simple sponge bath till the stump falls off. Now leave the cord until it falls off by itself. It's a natural process. It will come out by itself. In the past, doctors suggested that you could clean the cord's base with rubbing alcohol to help it dry out. But the current guidelines have changed. It naturally falls off by itself. Now make sure when you put diapers, you fold it in such a way that it rests below the cord to shield it from your little one's pee or poop. Now, in case if your baby has a very messy bowel movement and some stool gets onto the cord, make sure you immediately clean it gently with soap and water and keep it dry again. So like I said, the umbilical cord stump, if you follow these tips which I have told you, it is very rare for the stump to get infected. But same, if your baby was a premature baby or has certain other health issues, then you should be extra cautious and make sure that the cord doesn't get infected. So how do you know that the cord has been infected? So then you will have to look for these signs which I'm going to tell you right away. You will notice blood on the end of the cord, a white or a yellowish discharge around the cord, sometimes a little bit of swelling or redness around the cord, and you will also notice that there are signs that the area around the cord causes your baby pain. For example, your baby might start crying or fidgeting when you slowly touch the cord. So these are the signs that show that the cord is being infected. So the next question is, what are you expected to see when the stump comes off? Well, like I said, when the stump comes off on its own, you might see a tinge of blood. Okay, probably the baby's diaper or around that area, which is absolutely normal. Do not panic when you see a little bit of blood. But if there's a lot of blood as the cord separates, then call your doctor right away. And now if the cord hasn't come off even after 3 weeks, let me tell you, be patient. Make sure you always keep the area dry and make sure it's not covered by your child's diaper. Again, wait for 6 weeks. Even after 6 weeks, if it still hasn't come off and you see signs of fever or infection, then call your doctor. So even after the cord has come off, there might be a little yellowish sticky fluid coming out from that area. Where it is absolutely normal, it will go away in probably a day or two's time. Okay, it is basically it is not infection, it is not pus, it is a very normal process. So do not panic when you see a little bit of yellowish discharge. That happens when the cord is completely removed away. But for some babies, you might see a scab over the navel. Now this is normal too. But if your baby's stomach gets red, they have fever, and you notice a cloudy discharge around that area, then call your doctor. Sometimes a little scar may form a red mass on the belly button. Now this bump is called an umbilical granuloma. Now if you see this and if it doesn't go away probably in a week's time, then you must let your pediatrician know. Okay? They generally apply silver nitrate ointment to it and burn out that area so the tissue dries up. But remember, do not worry because the cord has no nerves, so it is definitely not going to hurt your little one. So let me just conclude by saying that the umbilical cord stump, it comes out naturally. It's a very natural process. Probably it takes 1 week to 3 weeks time. The only thing that we need to do as a parent is make sure that we keep that area clean and dry, which is important. And also at some point we should be very cautious and look for certain signs that it has not been infected. Now the moment we see that it has been infected, we must take the baby immediately to the hospital and get it consulted by a pediatrician. Okay, so take care and stay safe. Bye-bye.